Hi everyone. We'll start in 2 more minutes, okay?
Okay, sounds good.
Melissa, are you in a position to jot down some notes for me?
I'm sorry, you were talking to me?
Yeah.
Sure,
Are you in
yeah.
a position to take?
Yeah, I can do
Okay,
that.
thank you. All right. Okay, so we'll start at 7:10 promptly. As when we start, with everyone introducing themselves, I would appreciate very much if I could see everybody's face. So at least we can put a face to the people who are introducing themselves. So it's not 7:08, so we'll start at 7:10. Usually I try to start promptly. Going forward, we'll be starting at 7 p.m. promptly because that's the time that was sent. So I'm just giving people a little time to come in right now. Okay. So we are now at 7:10. Good evening, everyone, and welcome to our first Health and Social Services meeting for this year. We have quite a new faces online, and we have some guests online as well. For those of you who don't know me, my name is Francisco Leopold. I'm the second vice chair for the Community Board 9, as well as the chair for Health and Social Services. I thank you so much for taking time out of your busy schedule to join us tonight, to be with us on this platform. Usually we would have a meeting at the board office, but as you know, because of COVID, we have to meet on this platform for our the new members who are just coming on, joining. I'm looking forward to working with you, collaborating with you, and try to make things better and improve the quality of work life in our community. So now I will open the floor to everyone to introduce themselves. We have quite a few persons online now, so please introduce yourselves.
Hello, my name is Lorraine Brown, and I'm the CEO of One Brooklyn Health System.
Welcome.
Thank you.
Hi, good evening. I'm Enid Dillard, and I'm the Director of Marketing and Public Affairs at Kingsbrook at One Brooklyn Health.
Hi, good evening, everyone. My name is Melissa Severe, and I am a Community Board 9 member, just recently started this summer.
Hello, my name is Ian Sherman. This is my very first meeting, and I'm extremely happy and honored to be able to participate and to be allowed to participate. And I'm really looking forward to it. I'm currently a nurse practitioner, formerly an RN at Kingsbrook.
Good evening, Crystal Rogers, New York State Nurses Association. I'm with the Political and Community Organizing Department.
My name is Lauren Avellino. I'm the Manager of Community Affairs at New York Presbyterian Brooklyn Methodist Hospital over in Park Slope. Glad to be here.
Sorry, Lauren, you said you had a colleague coming with you. Is the person there?
Oh no, so my colleague Frances from Weill Cornell Medicine, she couldn't join tonight, so I'm representing both of us.
Okay, I'm sorry, everyone. I've been talking and saying welcome, welcome, and I was muted. I'm so sorry. And I think somebody has just joined us. Mr. Pierre, can you introduce yourself, please?
Hi, good evening, everyone. My name is Josh Pierre. Some of you may know me as the Borough Director for New York City Comptroller's Office. I'm no longer in that capacity. I'm here in my own capacity as a Flatbush area resident, and it's a pleasure to be part of this meeting today.
Thank you for joining us and welcome. So tonight, since we have quite a few, Caleb, did I hear you introduce yourself?
Hi, sorry, Francesca. Yes, my name is Khalid Nixon, Community Assistant of Brooklyn Community Board 9, one of the staff members. It's good to meet you all.
Okay, thank you so much. So I know each one of you have
Excuse me, Francesca?
Okay.
Hi. Hi, my name is Warren Burke. I am the first vice chair of the Community Board 9, and welcome. It's great to see such a good group of people and who have great skill sets, and we look forward to working with you. And I just wanted to welcome you. Thank you.
Thank you so much, Warren.
Also, friend,
welcome.
We have a dial-in member, 929-326-2764. If they could identify themselves so I can rename them in the group, that'd be great.
Yes, hello, can you hear me?
We can hear you. Please go ahead.
Sure.
Yes.
That's my cell phone number, and this is Lorraine Brown. I'm the CEO of One Brooklyn Health System.
Lorraine
Thank you
Brown.
so much.
It's Lorraine, L-A,
Yes.
capital R-A-Y, Lorraine.
Thank you very much.
You're welcome.
Thank you so much. Okay, so now I will for our guests that we have, I will open the floor for at least give each person 2 minutes to speak to us and let us know, give us a little more about your organization. So I will start with Miss Avellino.
Sure, thank you. Thank you so much for having me. So as I mentioned, I work at New York Presbyterian Brooklyn Methodist Hospital in the role of Manager of Community Affairs. I've been there for quite some time. And even though the hospital is located in the Park Slope section of Brooklyn, we serve all of Brooklyn. Our largest discharge populations actually come first from Bed-Stuy and Crown Heights, then from Flatbush and East Flatbush, then from Park Slope, downtown Brooklyn, Brooklyn Heights and Coney Island, and the list goes on. So a lot of our patients do come from Community Board 9. So we do a number of free community health programs. I came to the general board meeting last week, and I'm going to pop some stuff into the chat in terms of some upcoming events that we have. We do a series with the Brooklyn Public Library. We'll be featuring our chief of urology at a lecture next Wednesday with the library. And we have a lot of other things coming up. It's Breast Cancer Awareness Month, so we have breast cancer talks coming up. We've got talks on virtual learning, getting, the ergonomics of Zoom school, talks on stroke versus aneurysm. So lots coming up. In addition to that, which I had mentioned the other day, New York Presbyterian Brooklyn Methodist Hospital is opening up a new ambulatory center, the Center for Community Health, come early next year. So I'll put a link in the chat also with a website with more information on that. But we would love to collaborate with Community Board 9 and work together to get the word out about these events, collaborate with you on doing an event specific to the community board. And yeah, I'm happy to be here.
Thank you so much, and thank you for sharing. The next person I'll call on Ms. Brown.
Okay, thank you very much. I'm specifically calling into the meeting to talk about Kingsbrook Medical Center and the plans that we have for Kingsbrook. I want to first say that Kingsbrook Medical Center is not closing. And in fact, what we are doing is we will stop admitting medical surgical inpatients effective January 1st. However, we will continue to provide an emergency department or emergency room. We will continue to provide adult psychiatric inpatient services. In fact, we have 55 beds in adult psychiatric services. We will continue to provide inpatient rehabilitation services, ambulatory surgery services, and a comprehensive array of outpatient services. In fact, we are planning to expand the outpatient services on the Kingsbrook campus, and actually our Kingsbrook will become a medical village. In addition, we are making a significant investment in the Pierre Toussaint Health Center, which is on the Eastern Parkway. And that site is actually undergoing major renovations as we speak. And by the beginning of the year, January, February, we should be reopening to a totally renovated 2-story health center. So I just wanted to first talk about our closing of the medical surgical beds at Kingsbrook. The patients who come to Kingsbrook's emergency department who need to be hospitalized for medical surgical conditions will be transferred, if they choose to be transferred, to both Interfaith and Brookdale hospitals. The One Brooklyn Health System is comprised of Interfaith, Brookdale, and Kingsbrook, Rutland Nursing Home, and to the Shulman Shackley Nursing Home, as well as more than 12 outpatient center locations. We will continue to operate the Rutland Nursing Home on the campus of Kingsbrook. But going back to the issue in terms of acute care, if we have individuals from the community who walk to or are brought to the Kingsbrook Emergency Department, we will have a logistics center where we will be able to seamlessly transfer an individual from the ED at Kingsbrook into a bed at Interfaith or Brookdale. The One Brooklyn Health System received a significant commitment of funding from the state of New York to make major capital improvements on all of our campuses, including Kingsbrook. In fact, more than $135 million will be invested in the transformation of the Kingsbrook Medical Center to become a medical village. The investments include improvements in our inpatient rehabilitation services, totally redesigning our ambulatory care clinics, making major investments in medical equipment, and doing things that people may not see but they will feel, such as new roofs, new electrical systems, new fire systems, elevators. So One Brooklyn has made a commitment to that campus, but we've also made a commitment to all of the union staff who have committed themselves to Kingsbrook and to One Brooklyn. So as we are closing the medical surgical beds, we are working very closely with the NISNA union leadership and 1199 leadership because people are affected. In the case of the nurses, we have 107 FTEs who will no longer work at Kingsbrook, but we have worked out an agreement where every single one of those nurses will have a job, either at Interfaith or Brookdale, and on positions at Rutgers, at Rutland, and if there are other vacancies in the ED at Kingsbrook or the psych or the rehab center, they will have that option as well. Our commitment to NISNA is that not only will no one lose a job, but individuals will be able to transfer within our system, not losing a penny of their salary or any compensation that they have or any of their retirement benefits, their pension benefits, and other benefits that they have. We also have folks who are in the 1199 union and who will be affected by our no longer providing medical surgical services. And that includes approximately 262 FTEs. And as I've mentioned, we've worked as closely with the 1199 union leadership to ensure that every union member who wants a job will have a job within One Brooklyn. All of those individuals will have an opportunity for a position as well as opportunities for training to ensure that they are successful in their new positions. We also have identified the opportunity for those individuals who are eligible to retire based on their years of service and their age. And so for up to 200 individuals who meet that criteria, either individuals from 1199 or NISNA, we're offering an incentive, a modest but still measurable financial incentive if they choose to retire. All of these things have been put together with the unions. I can't emphasize that enough. We've also stood up a resource center, which is open 6 days a week, including Saturdays, so that the staff can come to the resource center, get information about positions, talk about what their specific options are with not only the human resources staff at Kingsbrook, but members from their delegates from their unions and experts from their unions in terms of pensions and other resources. So I just want to underscore, Kingsbrook is not closing. Kingsbrook, in fact, will be the healthcare campus of the future. We will have a full range of outpatient services, and we are also looking forward to the development on our campus on unused land of more than 400 units of housing. Hopefully, the individuals who move into that housing will take advantage of the ambulatory care services and the rehabilitation services and the long-term care services that we will continue to provide. And with that, I will pause to take any questions.
So my question to you is that I know you've been talking about your present workers. So with every the expansion and everything that you're looking into increasing the services that's been rendered in the community, will you be hiring new staff?
So unfortunately, things don't happen at the same time, right? So we will be ceasing our medical surgical inpatient services as of January. The expansions that we have, I mentioned the Pierre Toussaint rehabilitation that we're doing, the renovations that we're doing. Right now, the staff who work in Pierre Toussaint, while we are renovating that building, are working on the campus of Kingsbrook. So they will go back to their totally gutted new rehabbed health center in the early part of the year, January, February. For the other expansions, as I mentioned, we are totally redesigning the ambulatory care services on the campus. That is going to take us a couple of years. When we are ready to expand those services, we will be hiring staff. Some of the staff who have moved to Interfaith or Brookdale may opt to come back to work in outpatient settings, even if they had a position on an inpatient side. But we will be hiring people because we need people to provide that expanded services.
Thank you so much. Any questions for, and just before any question to ask, I would just like everyone to please, all of our guests, to please put your names and your information, your telephone numbers, and your email in the chat first, so we could have a record of it, so we can always, get in touch with you as need be. So anyone who has any questions for?
Yeah.
Hi. Oh, go ahead.
Oh, go ahead, Warren. Sorry.
No, you go first.
Okay, no. Ray, I don't know if I heard if what the expansion would be like for the adult psych. You mentioned that there were already 55 beds. Was that additional to whatever was there before, or that's what you normally have?
We have today we have 55 beds. What I did not mention is that we're going to be doing renovations to one of those units as well. One has been recently renovated, but our plan is to continue to have the 55 beds. Some folks may remember there was a study done. It was commissioned by the governor. It was called the Brooklyn Study. And in that study, they recommended that we no longer have psychiatric beds at Kingsbrook, and that we consolidate all of our psychiatric services at Interfaith. We're choosing not to do that. And the reason we're choosing not to do that is because the need for psychiatric inpatient services is really great in our community, and we're committed to continuing to provide that service.
Yeah.
Okay. Thank you, Warren.
Thank you.
You're
Hi,
welcome.
Mrs. Brown. It's Warren Burke. Nice to meet you.
Good to meet you.
The other, besides being involved with the community board, the other hat that I wear is that I'm chairman of the Kings County Hospital Advisory Board.
Oh, okay.
And we certainly welcome your presence at the meeting as well as what you're saying.
Warren, I don't know if you know, I worked 28 years for Health and Hospitals.
Ah, okay. I have no idea.
Right,
I know
that to Interfaith, yes.
Okay. Well, we work very closely with Diana Richardson.
Yes.
On the community board, and I know she's a spearhead for what you're doing, and I think it's terrific. I just, first of all, I hope you continue your organization's presence at our meeting.
Yes.
Number one. Number two, the things that I think you're doing are terrific, because our community in Central Brooklyn really needs as much health care as can be provided. As you know, we're probably the largest users of public assistance in Brooklyn, Central Brooklyn.
Yeah.
So I hope that your acceptance and all will continue. So I'm just interested in terms of Toussaint rehab. Is that for addiction or for physical?
No. So actually, the Pierre Toussaint Health Center is for primary care.
Okay.
We'll also have urgent care, but it's no addiction services are provided at the Pierre Toussaint.
Okay, so that's fine. And the other part is that I'm glad. Could you send our community board through Francesca maybe a bullet statement of what you reported today?
Absolutely.
Okay, because I think it would be
Absolutely. No-
benefit to our community to get it out.
Oh, certainly. And
Okay.
Enid Dillard, who's on the line, Enid will continue to be a liaison to the community board, but we'll make sure to send out some bullets that summarize what I said. I know I said a lot. And Warren, you should also know that I've spoken with Sheldon McLeod about
Good.
our plan.
Uh-huh.
And actually, he and I are committed to working closely over the next several months to make sure that as we close our medical surgical inpatient capacity, that if people choose and they don't want to go to Interfaith or Brookdale, that they can go to Kings County.
No, that's great. For transparency, our advisory board at Kings County is to represent the residents of our district. So
Yes.
we welcome all. We are certainly not involved with any inter-hospital competition or whatever, but we look upon what you're saying as a positive thing.
Yeah.
So
And
by all means,
right,
Go.
and because of frankly, my family is health and hospitals. My credo has been, particularly for Central Brooklyn, that there is no need for competition. We all
Right.
need to work together to expand access and create opportunities for the people who live in the Central Brooklyn neighborhood.
No, I agree 1,000%. I also have a view of the private hospital system from different boards I'm on. And I have to tell you that I don't agree with the competition between the hospitals. And in Central Brooklyn, we need all we can get. So by all means, welcome. And I just want to extend that to Methodists and other organizations that are on the phone. Please, let's all work together, and any information you have and you want to get across to the community, please send to the community board through Francesca. Thank you.
Thank you very much, Warren. Before we take any more questions, I just need to, for Lauren. Lauren, I realize that you have, there are a few workshops, if you may call it, sometime in October. And one of them that I really like is the one for October 13th. And it's not only for for remote learning, but also for people who are working at home also. So I would be very interested if you could just give us an outline as to the dates and times of those workshops and or the presentation more or less. But then it'll just elaborate on the one on 13th. I mean, all of the others are good, but then I just need you to elaborate a little bit more on the one on the 13th. Just take 2 minutes to do that because the time is going.
Sure. So thank you for the opportunity to do so. So I popped in the chat. We do have a lot of events coming up. As I mentioned, I'll just briefly go over next Wednesday, the 7th, we have a prostate health talk. The 13th is that ergonomics of learning talk, which I'll expand more on. On October 15th, we have a heart failures lecture. On October 20th, a lecture about mammograms and breast imaging. On the 29th of October, we have stroke versus aneurysm, and then a neck pain lecture on November 5th. A lot of these are in collaboration, either with the Brooklyn Public Library or a few senior organizations. So they're all virtual. The senior organization ones are happening earlier in the day, and the ones at the library are in the evening. Specifically, Francesca asked me to expand about the challenges of remote learning. So a few of our physicians, we have a physician, an orthopedist by the name of Kristen Russo, who's affiliated with Columbia University Medical Center. That's uptown 168th Street, New York Presbyterian. She, with everyone going back to school this week, previous weeks, there's concerns about kids spending a lot of time in front of the computer and posture and how that impacts their, growth and overall health. So we'll be hearing from an orthopedic surgeon, Dr. Russo, along with 3 physical therapists about, how to spot problems with posture and in Zoom format, correct it, and I think there'll be probably some exercises as well and things to look out for to adjust. And it is geared towards children, it's geared towards parents for their children going back to school, but it's open to all. And if this lecture is something that's of interest, we can always do, a targeted lecture. If you want something for adults in terms of working from home, we can do that too.
Yes, I will be very, very much interested in this, because right now, I believe in not wasting people's time. And I'm sitting here against my own judgment and the doctor's judgment, but I'm just coming from home. I'm just coming home from the hospital because with neck pain and dizziness and swollen feet and everything. And it's I was getting a little worried, but most likely it's from sitting at my computer all day, not walking and getting all those movements in my body, and my feet just keep swelling. And most likely my back rest is not good enough, so my posture and everything, so I think it is something. But you have so many people, and looking at how things are unfolding right now, I think someone has the phone open, so can you mute yourself, please? Thank you. And then seeing how things are unfolding right now, many of us will be working from home for a long time, and a lot of people are having issues with their back and the necks, and even my fingers. It's like I feel like I'm getting arthritis or whatever, carpal tunnel and whatever. So I think it is something that is, as much as it's good for the children because they're spending a lot of time in front of the computers, but for the parents, for the grown-ups also who are working from home, I think they need a little bit of help as to the best way to help themselves in the posture. The chairs that we use, I bought a chair, maybe it's good and maybe it's not good, and I bought a backrest, but I don't think it's supportive enough. We are sitting at our computers all day, and some of us, it's only this week I started walking, and some of us, we just get up from in front of the computer, we go to the bathroom, and we go to the kitchen, we eat, and we come back to the computer, and we need that help. So thank you very much, and I think it's something that I would look into for you to do a presentation on. I think it's much needed.
Great. Yes, I
Thank you
agree
much.
too. I usually take my lunch at my computer. I don't even get up. So I'm with you on that.
Yeah, sometimes I forget that I didn't have breakfast. I say, why am I sick? Why am I, I don't feel well. I say, oh, I haven't had any breakfast. And when I turn around, my breakfast would be sitting on the table, Okay, so I'll go over to Ian. Ian, can you, Sherman?
Hello. So I'm here just representing myself. I have no official representation. I just had, they had asked me to join, and I'm a community member, so I was glad to be here. But I'm a nurse practitioner. I do work for NYU Langone in an ambulatory setting in Flatbush. So I'm sure, should you want a liaison with NYU, I'm sure I could speak to the powers that be and become that person. But at the moment, I'm just me, just a community member who wanted to be involved. Actually, I was gonna
Thank you very much.
I was going to ask Ms. Brown.
Go ahead.
I actually, like I said, previous to working at NYU, I worked at Kingsbrook. Actually, I had the honor to be part of the sort of the crew that initiated Meakin 5 in 2014. And I was wondering if there's a plan to sort of have community-based psychiatrists, because I know sort of a big part of having the inpatient is having an outpatient network to refer to. And I mean, my information is 2.5 years old, but I know that it would have been a little bit of a challenge to get people appointments within Kingsbrook's psychiatric outpatient community. So I was wondering if there's a plan for maybe, I think, again, this is 2.5 years old, but I think at that point, Dr. Tabor and a few others were seeing patients at Pierre Toussaint. So is that going to continue? Is it expanding? That would be, I think, a huge boon for the community.
So this is Ms. Brown. To answer your question, yes, at Pierre Toussaint, we will have outpatient mental health services. And in fact, what we're working toward now is integrating ambulatory care services in a way that where there's primary care and mental health outpatient care together, so we can serve the whole person. So we will have outpatient services, mental health outpatient services at the Pierre Toussaint Center. We're looking, in the future, we're looking at expanding our array of services because, as you know, the need is great. And we're also looking to ensure that we create different models of services. So the Urgy Center at Pierre Toussaint is a new service, but an opportunity for folks to get their needs addressed quickly. And also we're designing the space. We're in this new era of not having a lot of people in waiting rooms. And so designing the space and also our processes so that people can get the care they need when they need it and as quickly as they need it.
So that's beautiful.
Okay. Thank you. As we move on, yeah, go ahead.
No, I'm sorry. No, I had a follow-up question to what Ian had raised. I think it's great that you're, doing that outpatient clinic. My question was, would there be an adjustment to like the schedule where people can see physicians, on weekends or after work hours? I know for myself, when I was looking for services, it was impossible to find anything that wasn't between 9 to 5, right? That was a real challenge. I finally found someone, but outside of outside of the very few providers that do weekends and nights, I would have had to pay like $300 an hour or something.
So that's an excellent question. And what I can say to you is we'll get back on the hours of services that will take place at Pierre Toussaint, but also on the campus, the ambulatory care services for the community board. I do know that we have extended hours. I know at the other One Brooklyn outpatient services, for example, our Bishop Walker Center, we have extended hours on Thursday night, and we have Saturday hours. And that is our intention throughout our system, to make sure that we're providing services when people most need them, and recognizing that people need to work or their children are in school. And so, but I'll get you the range of hours for each of our outpatient clinics that Edith can share with the community board.
Awesome, thank you.
You're welcome.
Okay, Ms. Dillard, is there, would you like to take a minute or two?
I'm sorry, I was muted. Thanks so much. Just kind of piggybacking on what Ms. Brown is saying, I just wanted to reiterate that here at Kingsbrook, we are expanding, we are growing, and we want to make sure that you're always in touch with us and we're in touch with you. We are very accustomed in the Public Affairs Department to be creating increased access to education and early detection efforts. And I'm working with my partners across the One Brooklyn Health System, my comrades in the Public Affairs and External Affairs Division, to continue that going. Now that we are in the pandemic realm, it's very, very hard now to do that level of outreach, but we'd love to make that more virtual. We'd love to work with Community Board 9 and members of the community to start crafting education that is meaningful in this time, and taking opportunities to take advantage of the virtual scope. So we want you to be in touch with us about what you think those needs are in the community, what you think in terms of virtual education is most needed at this time. Ms. Leopold just kind of outlined something that's incredibly important, and that is, the fact that we're becoming more sedentary as we're sitting here working in a COVID environment, and how that's affecting our bodies, and that's how that's affecting our children. We have a rehabilitation department that can most definitely add to those conversations, among others. So we want to continue reaching out to the community and providing access to education as much as possible, especially now that we're more virtual.
Thank you so much for sharing. Thank you so much. Ms. Rogers?
Hi, good evening. Thank you so much for having me and for giving me a few minutes. I want to thank Ms. Brown and Ms. Dillard. The New York State Nurses Association has agreed to work with One Brooklyn to implement an agreement that respects both our contract, our NISNA contract, and the operational needs of One Brooklyn Health System. And so I'm just here to confirm that NISNA is supportive of the transformation, and we're excited about the first step at Kingsbrook. I wasn't expecting New York Presby on the line, but since you're here, our members are actually looking for a response from your facility. Yvette Clark wrote a letter regarding psych services being moved off site. And so I know you may not have a lot of information, but we are looking for a response to the Congresswoman's letter, and we are looking for a response about those services for patients and how they're accessing those services.
Thank you for mentioning that, Crystal. I put my contact information in the chat box, and I could chat it to you directly. Feel free to follow up with me offline about that, and I can certainly see what's going on and get an answer for you and find out where we are on the response.
Great, thank you.
Thank you. As I look in the chat, I noticed that Ms. Avelino, she's the only one who have placed her information in the chat. I would appreciate very much if everyone can put their information in the chat, so I can I'm able to have easy access if I need to contact you. And also there is a G7 thing quick. I think I know who it is, but can you identify and identify yourself if you can show us your face, that I know who exactly the person is. Okay, I'm looking forward to hear from Josh Pierre. Can you take a minute or two to just introduce yourself again? And Melissa, as the information is placed in the chat, can you make a note of them for me, please? Melissa and Khalib. Mr. Pierre, go ahead.
Thank you. Hello again, my name is Josh Pierre. I have come to Community Board 9 a number of times, but in the capacity of Borough Director for New York City Controller Scott Stringer, I'm no longer in that capacity. So anything I do and discuss is based on my own community views and the fact that I am a district leader just further south in the Flatbush area. Some of the things that are being discussed here today are critically important. I know everybody's been overloaded with the need for us to fill out the census, so I'm not gonna hit too hard on that. But I do wanna talk about the fact that, just a few months ago, the City Council did pass its budget, and it did make some deep cuts. It made cuts to a number of things that impact healthcare within our city and social services, mental health, etc. We have to really have a focus on this, and I think this committee is critically important to that. Every time the budget does come up, we have to ensure that the council members that represent various parts of this district do come to this committee and come to this community board and explain to them what their priorities are and how they're going to protect social services, mental health from these types of cuts. If you're not familiar with some of the cuts that did take place, I will be putting into the chat an op-ed that I did on some of the cuts that we saw them debate last cycle. But it is critically important that we pay attention to the budgets, because at the end of the day, whether we have staffing, whether it be services, or whether it be capital improvements to the facilities that we have, are all linked to city, state, and federal funding. So I'm looking forward to coming back to this group and sharing more information, and I appreciate the opportunity to speak here tonight. Thank you.
Thank you so much for sharing with us. We're looking forward to getting some more needed information from you. My concern in the community, as I drive around, sometimes walk around, talk to people, and I think that most of you who work at the hospitals and you're walking around the hospitals, you would have noticed that the homeless issue is getting worse. The percentage has increased. And we have to have a dialogue, especially when you walk around the hospital, even going to Kings County Hospital, you find that a lot of homeless people, they wouldn't be in the lobby, you would find them out on the street. And you're seeing so many young people. And I mean, it is bad. One time you would see elderly people, middle-aged people, but you are seeing young people out on the street. We have sickle cell. Not too many people talk about sickle cell. You know, it's just something that is, you know, if everybody talk about cancer and everything else, and then sickle cell is just an underlying thing. We just say, oh, there is sickle cell, and no one, I will not say no one address it, but it's not in the forefront. And sickle cell, it kills. We have the mental health issue that is getting worse and worse. We have, with that comes depression, anxiety. I've known persons who work in the health, I just lost my train of thought, but work at the hospitals, and who contracted COVID, they had to go home, be treated, and then after, even before they were fully recuperated, they had to go back to the hospital to work, and they are back home, suffering with anxiety and depression. And this is what everyone, that we have a discussion as to how we deal with those issues that are rising or have been there, but it's getting worse. Then we have the shelters that we have to deal with. Residents at the shelters, the type of treatment that they're getting, everything that they're going through, and they themselves are depressed. They're going through so much at the shelters. Then we have the seniors that we have to deal with, dealing with COVID for the seniors, the services that the seniors are getting. And also we're looking to do, for us to have another, I know sometime last year, and Warren, as I speak, you can interrupt me as I go, an opioid training that we're looking to have in the community as well. You know, and the homelessness issue is getting really, really, really bad. The mental health issue, I was at a meeting with One Crown Heights, and one of the things that Rabbi Cohen touched on, the mental health, youth with mental health. And it is really bad. Right now, it has nothing to do with the older folks. The younger generation is suffering. The depression is so high, and we have to come up with issues and work. I'm so happy with all this, the health personnel who are representing different facilities that are here right now, because as it was said earlier, we may be at different homes, but we are one family. We all have one common goal, and it is for the betterment of our community. And we have to come together to find out a way where we can help our community in those areas. The shelters need help. Our seniors need help. The services that our seniors are getting, it's not to the capacity where it should be. We have a lot of people in shelters, and we don't have anybody online right now who really represent that area, but we have a lot of people in shelters, and the services that they need to get from the program directors at the shelters, the work is not being done, and they're just left alone in the cold weather by themselves, not literally outside, but they're just out there, and they really don't know how to navigate the system, what information that is needed. Because some of them, they don't know, well, hey, you cannot call a realtor or any facility manager and say, hey, I need an apartment. Do you have an apartment? Oh, yes, I do have an apartment. Well, I have a voucher. And anytime they hear voucher, then they hang up the phone and they must say, oh, I'm so sorry, the apartment is not available anymore. We have to come out with ways and come up with ways that we could help our community with the homeless population that is growing rapidly. Sickle cell awareness. I was supposed to have a lady from the NAACP who was supposed to join us to speak on the sickle cell awareness. Because last month was September, I think, was Sickle Cell Awareness Month. and the mental health issue. It is very, very, very important that we need to tackle this. And also maternal health, which I don't have on my list, but maternal health. It is very important. So we have quite a few areas that we have to work with. We have the homeless problem, we have the sickle cell that I really want to bring more awareness to that, the mental health issue that we need to tackle it head on. Residents at shelters, our seniors at the centers, and then the services that have been rendered to them, the opioid and maternal health. So these are what I'm looking for, so as we can deal with as the time goes. So anyone, I'm opening the floor for anyone who have any comment, anyone who has to say anything. If the floor is open, let's have a discussion.
So this is Lorraine Brown. I'm going to have to get off soon because my battery on my phone is dying and I'm sitting in a car. But I do want to say that we would be, One Brooklyn would be extremely pleased to come and present about the sickle cell services that we have in our system. We have a full range of comprehensive sickle cell programming from children to adults. And so we will follow up, and Enid will follow up with you, and we will bring our physicians and our other program folks to come and talk about the availability of the services that we have.
Thank you so
Hi,
much.
this is Warren
Forward
Burke.
to working with you.
Hi, Ms. Brown.
Hi.
Before you leave, I just want to say that the most nervousness in our community that I see is about the spike in COVID-19.
Mm-hmm.
And there's been plenty of publicity as to who's responsible, et cetera, et cetera. But one thing I would ask you is to focus on that, both physically as well as mentally, as well as Presbyterian and the other hospitals that are here, because it is really causing a lot of frustration on our residents.
Thank you, Warren. Will do.
Thank you.
Yes, and Warren, I am so happy that I have it big and bold on my paper for COVID, and I didn't mention it. So I am so thankful that you bring this up, because a few months ago, Warren, myself, 71st Precinct, in conjunction with I forget the name of the organization, we give out about 10,000 masks in the community. And it is, I don't know if you have read the news, or as you look at the news, the areas in Brooklyn that the spike is just getting higher and higher in COVID. And we do need PPEs in our community to give out. We have people who are working in the community. They are wearing a mask for 2-3 weeks because they don't have the money to buy a mask. And there are people who do have masks and they are not wearing the mask. And it is something that I don't know what more we can do. And it's a conversation that we are having, and I want everybody to chime in, because it is something from it's my health, your children's health, your family's health. And we have to take it into consideration. We have to take this very serious. And there is so much awareness. It's like every time you turn on the TV and you see notification everywhere, and then people, they're just not taking this COVID business serious. In spite of the fact thousands of people died earlier in the year, and people still, they're just nonchalant about everything that's happening. And it is a serious conversation. And right now, I have been trying my best to see what organization that I could tap in to get some masks, to give out in the community, because we got a little bit from the Borough Hall and also from the mayor's office, but they were not enough, and we need another 5,000 or more masks to give out in the community. We give out masks on Utica, and down to Claxon Avenue, on Kingston, and Nostrand Avenue, over 10,000 masks, but it's just a drop in the bucket. And so if you know of any organizations or your organization that can partner with us and let's get some masks and then go out in the community and give out some masks. But the awareness and the education, I don't know what more we can do, because it's on. The mayor talks about it, the governor talks about it, the media, everyone is talking about it. And it's just like it's falling on deaf ears, and it's getting worse, and it's getting worse and getting worse in our community. So if there's anyone who wants to touch on this and give some information on what else we can do, the floor is open as well.
So
Right,
I actually would.
Go ahead. Hold on, I think Lauren Hunt was up, and I'll come back to Ian. Go ahead,
Thank you.
Lauren.
Yeah, so we have surplus of face shields at New York Presbyterian that we are happy to send to you. We have a certain number of masks as well. We have, I think I have about, right now I have access to about 500 masks. The face shields I can get in quantities of 200. We can give a couple thousand or more if that's what the need is. In addition to that, we also have, experts in infection prevention and control, and also the emergency medicine experts. So, if there are, if there's an opportunity to give community talks about the importance of, hygiene and wearing the mask and PPE, we'd be happy. We have specialists who saw this firsthand day in and day out, as I'm sure some of the other medical professionals on the call have witnessed as well. So they certainly have firsthand experience and can give stories from the front lines.
Okay, thank you very much. Go ahead, Ian. Thank you.
Yeah,
We'll
so
get in touch with you on that.
I wanted to just say, sort of to address the pink elephant in the room, which is that by, at least in the media and also in reality, a lot of this, the spike in numbers has been within the Orthodox Jewish community. So I just want to sort of assure you that that is not going unnoticed by those of us who both live in that community and work in the medical world. I mean, I spent a good part of my March and April and May in the the makeshift ICUs of NYU Brooklyn, watching people die left, right, and center despite my best efforts. So I promise you that I'm bringing that personalized wrath to all of the people who I see not wearing masks. And there are quite a number of sort of community-based efforts underway from those of us who are sort of in the know to address what's been going on in Crown Heights and Flatbush and Borough Park, Williamsburg, elsewhere. So that those
Thank you so much.
I don't know exactly how. It's hard to measure success, but it is incremental.
Yeah.
I'll tell you, even just earlier this evening, I was filming a video of a bunch of us who were both live in the community and work in various healthcare jobs, sort of like education, tailored specifically to like the language, the customs, the day-to-day life of neighbors, and that sort of personalized approach. I think there's a good deal of efficacy, more than the very good efforts of Department of Health, the mayor, the governor, elsewhere. They're making a good effort, and I appreciate it, but that their message is not nearly as well received as somebody that they know, who they see in the grocery store, who's telling them to put a darn mask on, and here's why, and whatnot. So those efforts, I promise you, are underway, and they really are, and have been since since March, and God willing, we will have a bit more success than we've had thus far. That's but I do want to assure you that this has not gone unnoticed. We are the work is very much afoot.
Thank you so much. We appreciate you, Shane. Thank you. Anybody else?
Hi, Francesca. To your question about like, how do you get people to start wearing masks and whatnot? I don't know what the answer to that is, but what I have been doing is we recognized in my day-to-day, I work at the Department of Health and I do community partner engagement, and we recognized that there was kind of a language gap as far as what information is out there about COVID. So we've been doing webinars and presentations in people's native languages. So I've done presentations in, well, not me personally myself, but I've coordinated sessions that are in Spanish and in Chinese, and we've brought in health professionals that speak those languages to talk to people about what's going on. Because even though you may have some knowledge of English, but with you know, the medical field, it gets a little technical. You might want to hear it in your own native language. So I think that that's something that, you know, for the folks that are from from health institutions may want to, I don't know if that's already happening, but, you know, take that into consideration. More outreach in people's native languages when you're doing all of these support groups and info sessions. Have one that's in Spanish, have one that's in Haitian Creole, have one that's in Chinese, all of the big languages that are out there.
Yeah. You're very right, because sometimes as people walk around, they may see a poster, or you may be talking, you might be watching the television, because there are some keywords that will be mentioned, and sometimes they might not be able to understand it. And that is very important. And I think that is something that we can do. And as anything else, I think the how Ian is going about doing it, and he being the spokesperson for his community, that will be a city community, it's a good thing. Because, and he is right, because let's say, for instance, we're having an issue in the Haitian community, and then maybe I may go to the Haitian community, or Warren might go in the Haitian community to give out some information, and one or two persons, but then if they see Mr. Pierre, they're like, okay, you know, this is my people, you know, I can relate to that person, and that he will be able to reach them, I know, and they'll be on the common ground. So you are very right. And I think that it is something that we should really look into and work with the different communities to see as to how we can achieve that goal. I see someone that, whilst I was at the hospital today, that I met, and Ms. Blair, are you able to say something, introduce yourself? Thank you so much for joining. I'm home. I should have been in bed, so don't send the Calvary to me. I should have been in bed resting, but I'm online right now. I think this meeting is very important, so welcome, and please unmute yourself and speak to us. I noticed that you unmute yourself, but I'm not hearing anything from you. I can't hear you. Caleb, she's unmuted, right?
Yes, she is. Hi, Ms. Blair. Can you please go ahead and speak? You are unmuted. And we know that your hand is raised, but you're being acknowledged right now. Please go ahead. It could be a technical thing on her end, perhaps. I don't know.
Yeah. I think she's trying, but I'm not hearing anything.
Okay.
Okay, so
go back. Okay.
Ms. Blair, maybe you could put something in the chat, if you could write something in the chat, because we can't hear you. Okay. The person with G7 thing, would you like to say anything?
Oh, this is Nicholas Almono. I just wanted to say hi. I wanted to see how things going with this committee, and anything I can do to help, I'd be more than happy.
Okay, thank you. Desma? Yes, I can hear you. Yeah.
Okay.
Thank you so much for stopping by. Desma? Nick, is there anything you want to say before I move to Ms. Ross?
No, I just want to say I'm very much interested in health. I'm a science teacher for the last 40 years, and then I'm very much interested in this community, and to the community district. Whatever I can do to help, I'm here for that.
Thank you so much. Thank you. Okay, Miss Bless said she's still at work. Okay, thank you. Miss Ross?
Yes, hi, good evening. I just want to comment on this, the couple of things that you said. Knowing that you sit all day and less movements, and it's also related to, most people now, well, say maybe 50, between 50 and 75 are working at home and they're on the computer and less movement. So I think now is a good time to introduce healthy eating because they're not really getting too much of body movements, and that is where in my history of in the operating room, bad circulation and stuff like that. So I think this is now the time to incorporate healthy eating as well.
Thank you so much for the suggestion. Well taken point.
Okay.
Healthy eating.
Thank you. Thank you.
Okay,
Actually,
yes, somebody wants to say something?
I was just going to say, maybe this is not the moment to talk about it, but I just, since we're talking about sort of like cultural competence when it comes to education and how, a native Creole speaker is going to do a better job educating the Haitian community than I am, no matter how much good effort I put in. I've worn a lot of healthcare hats. One of the hats I wore was in chronic pain management, not just sickle cell, but certainly also sickle cell. And one of the things I sort of have noticed is that this is a long discussion, but there has been across all chronic pain management, including the management of sickle cell, a tremendous shift in what is considered appropriate care. And it is a shift that has been fairly brutal for a lot of patients. And that is both brutal and important because there's very, 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 very long story short, opioids were being overused, which resulted in short-term good for the patients and long-term harm. And that it is going to be exceedingly important to have sort of trusted healthcare partners. Doesn't even have to be a national expert, but a local trusted healthcare partner, and particularly healthcare providers of color, are going to have a lot more legitimacy telling a sickle cell patient than me, no matter how much I want to. And believe me, I have. But it is, just to be very blunt, it is very. I do not blame the African American person with sickle cell who is very distrustful that I'm telling them that they're taking too much pain medication, because I would also be distrustful of, like, what do I know? What do I know? What about sickle cell? So this is an area where I know you had mentioned. I think this is a real opportunity to really put to use all of the research and around, cultural competence in healthcare. That the person who's delivering the information is an extremely important part of whether that information is trusted and believed and acted upon, and how the sort of the person on the receiving end, in this case, let's say a person who's been suffering with sickle cell, how they receive that care and how to what extent they feel cared for and that they can trust the information they're getting. So I think that's an opportunity for a community board like this to sort of really engage people in the community to say, like, I know that in the past you were getting, let's say, high doses of opioids in the Kingsbrook ER, and now maybe you're not. And this is why not. And although in the short term that means you're in excruciating pain, and that is unspeakably difficult, there's a reason, and this is the reason, and explain the research and whatnot. Whereas my face delivering that message is not going to be as believed, and nor should it be, because what do I know about sickle cell? You see what I'm saying? Maybe I'm not articulating this well, but I think that there's a real opportunity to do community-based education on sort of this. There's been like a 180-degree shift in sort of the standard of care, and for good reason, because again, without going into too much detail, the opioid companies and Purdue Pharma and whatnot were killing people for profit, and that was bad. so there has been a big major change in the clinical care, and I think it would be that's a real opportunity to really educate people in a way that would be very meaningful and important, I think.
Thank you so much. It is very important, very, very important. And if it's like today, whilst at the hospital, and all the symptoms that I was feeling, and I don't mind sharing. Sharing is educating, and we learn from each other. And, whilst at the hospital and with everything that I was feeling, all the symptoms that I was feeling, the dizziness and the head pain and there's the sharp pain and the swelling foot and everything, it had me very concerned. And I'm not thinking, I'm like, oh, am I suffering from kidney problem? Do I have heart problem? Do I have this? And all those things that I'm going through my head, you know, and I'm some person who suffer with high blood pressure, you know, and in consultation, you know, and it is something that I'm aware of that, you know, after you've been on medication for a long time, you know, you are treating yourself for one thing, but then something else is happening in your body. And I think, again, that is where it is very important for the healthy eating and for the exercise. I think that I started doing the exercise too late because I was trying some next week Saturday is my birthday. And I was like, okay, I need to get this dress to wear for my birthday. And everything I put out of my closet was too small. The zip wouldn't go up. And I'm like, okay, I don't want to be a butterball turkey for Christmas or for Thanksgiving. So I have to lose weight. I will go out there. Now that shouldn't be a reason why I wanted to lose weight. I should think of losing weight because I want to be healthy. You know, I just want to get this blood flowing and keep myself healthy. You know, so I think that the exercise coming, that's where exercising coming, and just having that healthy state of mind that you want to be in good health, and that's where the healthy eating comes in. So therefore, we have a really good partnership right here online. And I want us to stay in contact. I know you won't be able to attend we meet the first Thursday of every month on the same platform. The information will be sent out the first Thursday of every month at 7. And every month the information, the Zoom login will be sent out. And I would like to stay in touch with each one of you and afterwards I would like to hear from the first vice chair. And I would like to the board usually meet the last, is this the 4th Tuesday, right, Warren, for our board meeting, general board meeting? Is Warren
That's
there?
correct, right?
Yeah, so the 4th Tuesday of every month is our board meeting, and I would like to have a health segment, you know, to have a different presentation because it is needed. Because I find that we have everything else coming. We have alcohol in our community. We have restaurants in our community. We have everything that is presented into the community, but we don't have anything when it comes to health, you know? And so I think that is something I'm looking at. Yeah, that is something I'm really looking forward to, that we can have a health segment. I like this thing that says, don't let COVID-19 delay your mammogram. You know, heart failure, what you need to know. And I know all our different partners from the health facilities, each person will be bringing something different to the table, you know, and I would like to stay in contact, and I would like you to stay in contact with me, as Warren said earlier on, that we can work together. You know, we bring everything together to the table, and then we work it. We cannot solve everything in one go, but step by step, we take baby steps, and then we will reach our goal. So I would like very much, I am so happy with each one of you taking your time out, being here with us, being here with me and sharing with me. I know that Ms. Blair, she would have some sort of information to give, but in her chat, she said she's working and her computer isn't working, you know, properly, so she won't be able to. I'm looking forward in the next month that she can join us and share with us, because she too would like to partner with us. She have a wealth of information with all the CBOs that she's been working with, all her connections. So she too will be part of the CBN committee, and then she'll be working with us and will be bringing a wealth of information to the table. So therefore, yes.
Hi, it's Warren. I'm sorry I couldn't. I'm getting old. I can't react as quick as to unmute myself.
No, you're
But
not
anyway, first of all, I want to thank everybody. This is really terrific. if you ask the primary concerns and fears of our residents, there's healthcare, there's housing, there's financial insecurity, and the list just goes on, especially what's going on with the schools. I mean, parents are jumping out of their skins. I just really want to alert everybody and Ms. Brown and all the other hospitals that we really do have a mental illness need here. And especially with COVID spiking, as on a personal statement, I'm personally very nervous because I just read today that a block from me, the area code, the zip code, was put on Governor Cuomo's list. So all I'm saying is that, you know, just go out there and just do stuff for us because we need help. Thank you.
Yeah. And I am so much appreciative of Ian talking about, I'm looking to see if he's still there, talking about him and his community, how he will be working together with his community and bringing out the awareness. So I'm really thankful, and in our community and other communities as well, because there are, so I know, Ian, you said, well, you know, the city community, but then it's the Brooklyn isn't made out of only the Hasidic community, and then there are other communities who are working out there who are not wearing masks as well. And it's really, you know, it really rubs me the wrong way. And if you just say something to them about wearing your mask, they want to attack you. You know, they want to throw rocks at you or push you on the car or something, you know, and they don't realize the danger of it all. So I thank you so much for, you know, for what you said, for working. And for those of you who are able to get us some, our community is in dire need of PPEs, because right now we have so many people in our communities who are not working, and they're making this drastic decision. Am I going to buy masks, or will I buy food for my community, for my family? Warren, can you mute yourself, please? And what they do, they buy food for the family. So therefore, they're walking on the street. They have babies and themselves and the mothers and everybody walking on the street without a mask, you know, and everybody around them, if they're carriers, everybody around them are getting infected, and we don't know who have it and who don't have it. So please protect yourself as you're out there. And if you know of any organization, as as Lauren says, she have a few masks, I think that she will be able to donate to us. And if you know of any other organizations that you could partner with, and we can work together. So when we go out there, it won't be Community Board 9. We will be working together to go out there and giving out the masks. Okay, because we are one community. So as I said, I look forward so much for working the continued partnership with you guys, and we could work together and then, you know, really help the community, because the need is great and it's getting greater. You know, as I said, we have the population due to COVID, the homeless population is terrible, the sickle cell, mental health. So as before we go, we have to choose, because I don't like just, when I am working with a group of people, I don't like to just throw things at people and say, hey, this is what we're doing. So I want feedback for me for the next, this month of October to December. I would really like us to focus on mental health and COVID and getting PPEs to help out people. We have sickle cell and we have the shelters and the seniors and the opioid training. And I think that the two main ones that we should really concentrate on is mental health, the mental health training and COVID. For the next month meeting, I will bring it. The first vice chair is there. Warren is there, because usually if we are having someone to do a presentation at the community board, what we usually present it. It comes to this committee first, and then it's taken to the executive committee, presented to them, and then we move it. It's voted on to do a presentation at the board. And Lauren, I would really like to have this a presentation on this ergonomic a presentation of the ergonomic remote learning thing that you will be doing. I'd really like to do something like that if you offer the, because I think it's very important with the children that we have working at home. We don't want to walk. We don't want them for the next 3-4 months that they walk in the street with a humpback, you know, and you know their bodies are they're still young, the bones are still soft, and they're all bent out of shape. So I would like to ask you if it's possible that you do a presentation, organize to have a presentation at our next board meeting, which will be on October 27th.
Sure, I'll circle back and let you know. I'm sure we can get someone to come talk about it. And do you want to gear it towards adults or children, or does it?
I think it will be great to have, because most time, Warren, it usually be like a 15-20 minutes presentation.
No, actually not. We've been making an effort to keep the meetings under a time limit of 1.5 hours. So if you figure 5 or 6 minutes, that would be great.
So for that, I think if we can give a little bit more, like 10 minutes, because she will be touching both for children and for adults.
Francesca, you know whatever you want.
We'll talk about that offline.
No, I'll talk about it now, and whatever you want will be done. Okay. So.
Okay.
Okay. All right. Thank you.
We can work on that, around those parameters, and also just so the group knows the one that's happening on October 13th, which is next or a couple of weeks from now. It's open to everybody. It's in the evening, and anyone can register for it. So the link is on that flyer that I gave.
Okay. So thank you very much. So it's now 8:27. I don't want to keep you too long. Any longer. I would like to thank everybody. I was been looking in the chat and I didn't see information for everybody, but I guess I could always get those information later. But for all those of you who came and for sharing, I thank you so much, and I'm looking forward to seeing you at the next meeting, at our next meeting next month, which will be November 5th. And whatever information you have, you can email the board. So if you have any information, you need to contact me. You can email the board, and I will get the information, whatever it needs concerning the PPEs. But I'm looking forward for us to work towards the COVID situation in our neighborhood with the PPE, and maybe even getting information in different languages, you know, to give out. And I think that's a very good idea. And Josh, do you have anything to say before we go concerning that area? Josh, are you there? I guess not.
Hi, Francisca. Can I say something?
Yeah.
Yes. Just in, you know, and everything that we've been talking about with the cultural competency, you know, that Ian shared and I shared, I was wondering if maybe we can consider for, you know, whatever next presentations that we do after Lauren does her presentation, maybe we could have somebody speak about health equity as well, because that's a big issue that's come up, especially with COVID. You know, there's a disparity in healthcare, and I don't know if that's something that's ever come up in this kind of forum, or if you've ever done anything like that, but it would be great to have somebody speak to that, because that's an actual issue that people are experiencing.
Thank you very much. Thank you. So this is something that we'll look into. Ms. Blair, are you there now? I noticed that you are logging in. Are you able to say anything before we close? Okay. She's still muted. All right. So I thank you so much. So we will talk about it. We will have a side line on that. Melissa will talk about that some more. So But in the meantime, we will try to concentrate, get some information going. How maybe we might be able to bring in somebody to talk to people about when it comes to the kids, you know, how they could see any signs of mental health or depression, because I know a lot of the young kids are getting depressed. They're not able to go back to school to see their friends. You know, they're just home behind closed doors, and how it's affecting the youth. And I think that we need to touch on that also. So once again, I would like to thank everyone. I'm so sorry, Ms. Blair, that we're not able to hear your voice, but hopefully the next time you will be able to chime in and say something. Just get the voice mic on computer. Keep feeling. Okay. All right. So have a good night, everybody. The dialogue was great. I'm happy for the dialogue that we had, and I look forward to us working together and you know, just helping our community, because our community is in dire need. You know, so much is happening out there when it comes to, as Melissa said, the health equity we have. We could talk about the foods that come in our community. We have maternal health that we have to deal with also. So many young mothers, they are dying in childbirth. You know, we have, and as I said, we have our seniors. The services for our seniors is just like nothing. They are not getting the services that they are supposed to get. But in the time that we're in now, we have to focus on the COVID, what's really affecting us and affecting our, it's coming right to our doorstep. And then we have to do something about it. So whatever that we can do to eradicate that, so that everybody could come together and have that awareness that, hey, I need to protect myself. I need to protect my family. I need to protect my neighbor. So we need to do something about it. And if we can get flyers in different languages and we could go around in the community and give it out, whatever that we can do. But it's one for all and all for one. Let's work together and we will make it happen. I thank you so much thank everyone so much for being on tonight. I don't regret not laying in my bed and you know, resting. I'm very happy that I came on, because I was thinking that I should cancel the meeting and, you know, and try to get some rest, but I'm so happy that I did. So have a good night, and I'm looking forward to speaking to you, Lauren, for our next meeting, for the meeting next month for the presentation, and for I'm inviting everybody to our board meeting. Come on, chime in onto our board meeting and see what it's all about and have conversation. You have an opportunity to ask questions, introduce yourself, and be part of the conversation on the board. Even though you don't live in our community, but then, and you want to join, you want to see what's happening, you know, just join the conversation. We may not live in the same Brooklyn Heights community, and it doesn't matter where you live, but we are brothers and sisters, and we all have the same common goal to improve the quality of life in our community. So let's have a conversation and stay in contact. Good night, everyone. And Lauren, I'll send you an email, or you can, you know, send me an email, and then we'll keep in touch. Have a good night, everyone. I'm looking forward to see you on the Zoom platform for our community board meeting.
Good
and
night,
for our
Francisco.
next meeting.
Take care of yourself and get
Good
well.
night.
Night all.
Thank you
Good
so
night.
much.
Take care of yourself,
Good
Francisco.
night.
Good night. Rest up.
Thank you. Thank you. Thank you so much. Good night, Miss Blair.
Good night, all.
Good night, Josh. Good night. We'll keep in touch.